Second motion, Senator Colin Burke. I'd like to welcome Minister Lynch to the House. Minister, you're very welcome. Senator Burke, you have 4 minutes.
Thank you very much, Minister. I'm raising this matter in relation to a drug which is suitable for some MS patients, but I accept fully that it's not suitable for all patients. And I have a number of people who have been in contact with me where they're paying over €300 a month for medication. They're not entitled to claim under the drug refund scheme, and as a result, and this person is on a medical card, they are now finding it extremely difficult. The drug they found is suitable to them. It has been recommended to them by their medical consultant, medical advisors. While it is available for sale here in Ireland, it's not been included in the drug refund scheme. I accept fully, Minister, that it's not suitable for every MS patient, and it's not the solution for every MS patient, but it is extremely beneficial to quite a large number of MS patients who feel they're now, I suppose, being sidelined in the sense that even if they didn't have a medical card, they're not getting any benefits whatsoever, in the sense that the first €144 they'd have to pay themselves, and the balance would be taken up under the drug refund scheme. And as a result, some people, and in some areas I understand the pharmacies are charging over €350. And I'm just asking if it could be included in the drug refund scheme.
Thank you very much, Senator. I would say, as usual, you probably bring the most pressing issues in relation to health. Decisions on which medicines are licensed for use in Ireland and which are reimbursed by the taxpayer are not a political or ministerial decision. These are made on objective, scientific and economic grounds by the HSE on the advice of the National Centre for Pharma Economics. Beg your pardon. The HSE has statutory responsibility for decisions on pricing and reimbursement of medical products under the Community Drug Scheme in accordance with the provisions of the Health Act, Pricing and Supply of Medical Goods Act 2013. At the outset, I would like to clarify that Pharmadane, brand name Fampyra, was never available to multiple sclerosis patients under the GMS and community drug schemes, and I'm not suggesting for 1 minute that you're saying that either, Senator. However, I understand that the manufacturer of Fampyra supplied the drug free of charge to some patients who were prescribed the drug by their clinicians. The manufacturer has stopped supplying the drug free of charge, thereby requiring these patients to finance the drug themselves if they wish to continue with this drug treatment. The HSE did receive an application for the inclusion of Fampyra in the GMS and Community Drug Scheme in accordance with the agreed procedures. The National Centre for Pharmacoeconomics conducted a pharmacoeconomic evaluation of the drug. That evaluation, published in 2012, concluded that it was unable to recommend reimbursement of the product as the manufacturer was unable to demonstrate sufficient effectiveness and a fair price for Fampyra in the Irish healthcare setting. On foot of this, the HSE has decided that it was not in a position to add the drug to the list of reimbursable items supplied under the GMS and other community drug schemes. The manufacturer, Biogen, submitted a new application to the HSE on the 25th of July last year for the inclusion of Fampyra in the community drug scheme. The HSE corporate pharmacological unit has since been engaged with the company seeking improved commercial offerings, and the HSE is now considering the outcome of these commercial engagements. The HSE has also had discussions with the clinical experts regarding this drug, the outcome of which is also being considered. I want to assure the House that the HSE and I fully understand the concerns of patients regarding the availability of this drug. But while I appreciate that some may take the view that the taxpayer should reimburse every licensed medicine for whatever the price the drug company demands, I hope it is appreciated that the better interests of the health service require that we only reimburse the most effective medicines and only at a fair price.
Senator, question.
Thank you very much, Minister, and thank you very much for a comprehensive reply. Minister, you were saying that there are some ongoing discussions. Have we any idea, Minister, as to when they may conclude, or is it very much it's a case of how they move over the next few weeks, I presume? We have no indication that we will have some progress on this matter.
Well, I suppose we can't. Thank you very much, Cathaoirleach. We can't preempt what the outcome of the discussions will be, but the fact that the discussions are ongoing, Senator, I believe is a positive action. The other, in relation to the effectiveness of the drug and the engagement with clinicians, we already have the results of that, and that is being considered as well. It's not just, as you have seen in the past, we have agreed to reimburse extraordinarily expensive drugs. It's not just always about the price. It is about the effectiveness as well and how that will, but we are engaging in that fashion, so I wouldn't say that all hope is lost. I believe that we will find a solution, and once again, I suppose like we did with other drugs, I would appeal to manufacturers to be sensible and reasonable about the type of hope that these drugs can offer to people who clearly would be very distressed at getting this diagnosis, and we do need to keep engaging with both the manufacturers and the clinicians on this, but we haven't concluded that yet, but I would be hopeful that it would conclude at a very early stage.
Thank you, Minister.